who I trust very much said this is our best shot. We should do it, so I decided to go ahead and do it.
And there was nothing to lose by trying this.
I said, you know, this is going to work. And I had that idea all through it. This is going to work.
Having a good attitude increases your odds of success with any treatment. So does taking your meds, making lifestyle changes, and in the case of Vasomedical's EECP therapy, making the commitment.
It requires 35 one-hour treatments. That's clearly important right up front.
They've gotten to know me pretty well at the doctor's office.
So what's going to happen an hour a day, 5 days a week for 7 weeks?
Well, first of all, they're going to have their legs squeezed, whatever their heart rate is, 80 times a minute, and it's a fairly vigorous squeeze.
There's pressure on the lower extremities, which does force blood flow back toward the heart, toward the central circulation, and jousts the body a little bit, but not to too great an extent. And in our experience, patients have had no problem tolerating it.
I fell asleep a few times. Or you can lay there and talk, or you could lay there and read.
They are carefully monitored, so the blood pressure is monitored, the pulse is monitored, the oxygenation is monitored. It's done in a setting where you have typically a nurse or a technician available to, stop it at any time. It's a very, very safe procedure.
How much easier can it get to get your life back?
The patient generally, after about 10 to 15 treatments, starts to feel a difference in terms of how frequently the angina is occurring, how severe it's occurring, how long it's lasting, and continues to improve over the course of the therapy.
That's what all the squeezing and releasing is about. It isn't at all random. Leads, like EKG leads, hooked to the machine help detect your heart rhythm. When the machine is switched on, the sensors, timed to your pulse, trigger the cuffs around your legs to inflate and deflate in sequence. The inflation of the cuffs squeezes blood from your legs, pumping it back to fill your heart. The cuffs become an external pump, assisting your heart. Enhanced External Counterpulsation Therapy, EECP.
It took about midway through the 7 weeks, and I started noticing a difference then. Just how I was feeling in general, the pain level, everything was slowly getting better.
Okay, but how does EECP therapy actually help? In medical terms, what's the mechanism of action?
EECP may in fact serve to alter the properties of the blood vessels themselves and make it easier for the heart to pump blood and for the blood to flow through the vessels to the body.
I'm really convinced the blood flow to the heart muscle is improved. The efficiency of the heart muscle is improved.
And what this does is it makes it easier for the blood to be pumped through the body and take some of the work off the heart, may expand the arteries of the heart so more blood can go to the heart.
So this relief of chest pain is presumably not just sweeping the pain under the rug, so to speak, the equivalent of giving an analgesic, but it represents a beneficial effect upon the heart and its blood flow.
Most of my patients who we're doing this on have angina and left ventricular dysfunction, so they don't have normal heart function. So it works in those patients, and I don't see any reason why it shouldn't work in people whose main symptom is heart failure.
I've treated a lot of patients with heart failure with EECP. They generally tolerate the treatment well. Not only do their anginal symptoms improve, but also their heart failure symptoms.
It seems the benefit from EECP treatment results from having all that blood quickly and vigorously return to your heart. Researchers think this forceful reperfusion produces the same effect as brisk exercise.
EECP may be like exercise training for people who can't exercise.
And that passive exercise, again, takes them to another level in which they can maintain an exercise program.
They'll start to be able to do more before getting chest discomfort.
In about 5, 6, 7 treatments, I noticed I wasn't as short of breath, I could do more, and it just got better.
They may even have their chest discomfort totally eliminated.
The effects after EECP varies. Some patients will have a very good durable response that will last 2, 3, 4